Assalamu alaikum. I am Dr. Sagia Afrose, Associate Professor, Department of Pharmacology, Bashundhara Ad-din Medical College. Today I am going to discuss about the drug absorption. What is drug absorption? Drug absorption may be defined as a process of transfer of drug from its site of administration into the circulation across the biological membrane. What are the sites of our drug absorption? There are several types of drug absorption like GI tract, oral and parectal route. Number 2, muscle in intramuscular route, subcutaneous tissue in subcutaneous injection, in skin in case of topical administration of drug, and respiratory tract in case of inhalation of the drug. What are the processes of drug absorption? There are two major processes of drug absorption. Number 1 is passive transport and number 2 is specialized transport. Number 1, passive transport. There are two types of passive drug transport. Number 1 is passive diffusion or simple diffusion and filtration, and specialized transport are carrier mediated like facilitated diffusion and active transport. Now I am going to discuss about the simple diffusion. What is simple diffusion? The definition of simple diffusion is the drug diffuses across the biological membrane along the concentration gradient from higher to lower concentration, and the membrane plays no active role in these processes. It is the most important and commonest process of drug absorption. Almost 99% of drug is absorbed through this process. What are the criteria of simple diffusion? The commonest process of drug absorption, number 2, occurs along the concentration gradient. Number 3, no energy is required. Number 4, no carrier protein is required, and comparatively slow process. Filtration. What is the definition of filtration? Filtration is the passage of drug through aqueous pore in the membrane or paracellular space. What are the criteria for filtration? There is no energy required, no carrier protein is required, and lipid soluble drugs crosses biological membrane by filtration if their molecular size is smaller than the diameter of the pore. Now the facilitated diffusion. The definition of facilitated diffusion is the movement of the drug molecules through a biological membrane along the electrochemical gradient from higher concentration to lower concentration with the help of carrier protein and without expenditure of the energy. Now, what is active transport? The definition of active transport is movement of the substance across the cell membrane against the electrochemical gradient from lower concentration to higher concentration with active expenditure of energy by the help of carrier protein. Examples of active transport like levodopa, methyl dopa, etc. What are the types of active transport? There are two types of active transport. Number 1 is primary active transport, number 2 is secondary active transport. Primary active transport, here the energy is obtained directly by hydrolysis of the ATP, and in case of secondary active transport the energy is derived secondarily from the concentration gradient produced by the primary active transport. Now I am going to discuss about a very important topic that is called factor affecting the drug absorption or factor modifying the drug absorption. What are the factors that modify the drug absorption? Number 1, lipid solubility of the drug. Number 2, routes of drug administration. Number 3, chemical nature of the drug. Number 4, molecular weight of the drug. Number 5, degree of ionization of drug. Number 6, pH of the absorptive media. Number 7, surface area. Number 8, motility of the gut. Number 9, presence of food or other chemical substance or other medication, and number 10, blood supply of the absorptive media. pH of the absorptive media. Why modify the absorption of drug? Because a acidic drug in acidic media is less ionized and more lipid soluble, so this drug is more absorbed in this pH. In case of basic drug in acidic media, this drug is more ionized and less lipid soluble, so less absorption of the drug occur. Now, an important topic called bioavailability is discussed. What is bioavailability? The meaning of bioavailability. Bio means drug, that is systemic circulation, and availability means how much the drug is available in the systemic circulation. It is the percentage of administered drug available in the systemic circulation. If the 100 milligram of drug is administered orally and the 60 milligram of drug is reaches to the systemic circulation, then the oral bioavailability of that drug is 60% for in this case. What is the definition of bioavailability? Definition of bioavailability means the fraction of unchanged drug reaching in the systemic circulation following administration through any route. What are the importance of bioavailability? To assess the plasma concentration of the drug, to assess the loading dose, to compare the different formulation of the same drug and compare the different formulation produced by different companies. Here a very important note is bioavailability is 100% in IV route. What are the factors that influences the oral bioavailability of the drug? The factors that influence the drug absorption, all factors are influencing the oral bioavailability of the drug, and in addition the first pass hepatic and also the first pass hepatic metabolism also modify the oral bioavailability of the drug. What is first pass metabolism? The definition of first pass metabolism is metabolism of drug molecule before reaching into the systemic circulation after absorption through any route. What is the mechanism of first pass hepatic metabolism? Absorption from gut, portal circulation, liver, and then metabolism of the drug. What are the sites of first pass metabolism? There are several sites for first pass metabolism, mainly the liver, gut wall, stomach, and lungs. What are the factors modify the first pass hepatic metabolism? There are 4 major factors that modify the first pass hepatic metabolism. Number 1, route of drug administration. Number 2, hepatic circulation. Number 3, hepatic biotransforming enzyme activity, and number 4, hepatic pathology. Now, what are the importance of first pass metabolism? First pass metabolism decreases the bioavailability of that particular drug. It required higher dose to get the desired effect, and more adverse effect may occur in this case, and significant amount of drug is lost. So, we have to choose the alternative route in this case. What are the routes that bypasses the first pass metabolism? The IV route, the intramuscular route, the subcutaneous route, transdermal route, parrectal route, sublingual route, and inhalational route, all these routes can bypass the first pass metabolism. Thank you so much. This is all for today.